Hi everybody, I'm Jo Easton from the audience team at the Bangor Daily News. Thank you for joining us this evening for a conversation about PFAS chemicals. For tonight, what we're going to be talking about is what are they and where are they? How did they get into our environment and what's being done about them? Our conversation tonight will be co-moderated by Tricia Rouleau, Farm Network Director at Maine Farmland Trust, and by Mehr Sher, Bangor Daily News environment reporter and Report for America core member. With us are three panelists who can speak to specific challenges that address how PFAS are impacting water, agriculture, and health. For those of you here tonight who are subscribers, donors, or advertisers, thank you for your support. Thank you also to our tourmaline sponsor, Harvard Pilgrim Healthcare, to Report for America and the Unity Foundation for their support of environmental reporting at the BDN, and to Maine Farmland Trust for being such wonderful collaborators on this event series. It's been a real pleasure. The Bangor Daily News aims to bring Maine together through fact-based local journalism that reflects our communities and helps Mainers think through important local issues, like this one. We hope today's discussion and the second PFAS panel we'll be hosting in November will help you make informed decisions for your work and for your family. As a reminder, this event is being recorded. During the course of tonight's conversation, please use the question and answer function at the bottom of your screen to ask questions. And if they're for a particular panelist, please mention who you'd like to answer the question. We'll get to as many of them as well as some of the pre-submitted questions that you sent us during registration, as many as we can during the second half hour. It's my pleasure to be able to introduce Bill Barassa from our sponsor, Harvard Pilgrim Healthcare, who is going to say a few words and introduce the moderators and our panel.
Thank you, Jo. It's such a pleasure to be here this evening and supporting the Bangor Daily News and to support such an important topic. At Harvard Pilgrim, our mission is to guide and empower healthier lives. And this is a great opportunity to support a discussion around these forever chemicals and how they are affecting the health and well-being of all of us. I can't say that I've been living under a rock when it comes to this topic. But let's just say, be thankful I'm not your main presenter this evening. I'm looking forward to a deep education as well. With that, let me introduce our panel of experts. First, our moderator, Mehr Sher, is an environmental reporter at the Bangor Daily News through a partnership with Report for America. She writes about a range of topics, including water, waste, pollution, air, energy, forests, and climate. Prior to joining the Bangor Daily News, she spent 6 years reporting in Pakistan. She obtained a master's in journalism from Columbia Journalism School with an honors in investigative journalism. Welcome, Mehr. Next is Tricia Rouleau, who is the Farm Network Director at the Maine Farmland Trust, a statewide nonprofit that protects farmland, supports farmers, and advances the future of farming. Tricia partners with farmers across the state who have been affected by PFAS to understand their needs, offer emergency relief and support through the PFAS Emergency Relief Fund, which the Trust co-administers with the Maine Organic Farmers and Gardeners Association. Welcome, Tricia. Next is Meagan Hennessey, the Director of PFAS Response at the Maine Department of Agriculture, Conservation, and Forestry. In her role, Meagan works to develop and manage state assistance programs, guidance, and technical resources for farmers impacted by PFAS, as well as collaboration with partnering agencies and groups to promote statewide PFAS policies and programs. Welcome, Meagan. Next, Dr. Jean MacRae, who's the environmental microbiologist and environmental engineering faculty member at the University of Maine. There, she teaches topics such as the introductory environmental engineering, wastewater treatment, air pollution, solid waste management, and researches biological remediation in the role of microbes. She is affiliated with the Maine Center for Genetics in the Environment and the Senator George Mitchell Center for Sustainability Solutions, where she is part of 2 research teams working on PFAS contamination and materials management. And lastly, I see Dr. Nesin has joined us. Good to see you, Dr. Nesin. Noah is the primary care innovation advisor at Penobscot Community Healthcare after having served as the Chief Medical Officer since 2014. In his role, he works to improve primary care for providers and patients. And he's also the past president of the Maine Public Health Association Board of Directors. Before I turn this over, a real quick reminder for those who purchased your health insurance directly through us or through the state-based exchange. Open enrollment begins 1 week from today. How exciting, 7 days. For those who may purchase their coverage through an employer, I'm actually guessing you're going through this open enrollment period currently. Healthcare and health insurance is a complicated topic. Information on the exchange, our website is available. Don't hesitate to reach out to us, your employer, your broker partner. We stand ready to assist. Now I will turn it over to Tricia to, as they say, get the show on the road. Thank you.
Thank you, Bill. Thanks so much. And thanks to everyone for being here, and to Joe for your excellent troubleshooting. First, we'd like to start off with a brief introduction to what PFAS are and how we got here. PFAS stands for per and polyfluoroalkyl substances. This is a group of thousands of man-made chemicals that do not naturally break down in the environment due to their extremely stable chemical bonds. As a result, they accumulate in our environment, our food chain, and our bodies. PFAS have water and grease-resistant properties that have been used in a variety of household and industrial products for decades. You can find them in firefighting foam, some food packaging, and coated paper products, as well as some cookware and some water-resistant clothes. We know that PFAS can get into river water when wastewater treatment plants dispose of their treated waste into rivers. We also know that beginning in the 1970s and continuing over several decades, farmers were encouraged to spread nutrient-rich sludge from wastewater treatment plants and paper mills onto their fields as fertilizer. Only later did they learn the waste contained chemicals that have been linked to serious illnesses such as decreased response to vaccines and kidney cancer. With that context in mind, Meagan, we'd love to ask you our first question. PFAS chemicals have been around for a long time. When did Maine realize there was a wide-scale problem, and what has happened as a response?
Yeah, thanks, Tricia. So in terms of the perspective from agriculture, in 2016, there was a dairy farm in Arundel, Maine, which did have a history of residual spreading, and a public water supply was conducting routine monitoring when they recognized there was PFAS contamination. So that really started the conversations. Then in 2019, Governor Mills created a PFAS task force charged with making recommendations regarding safe drinking water and food and identifying and investigating PFAS in the environment. Meanwhile, Maine DACF, began testing milk in Maine, those that were produced and bottled here in the state. And in 2020, a retail sample did lead to the identification of a second PFAS impacted farm, and DEP conducted further water testing, which led to a third identified farm. So at that point, I think everyone's really started recognizing that this was a big conversation to have. Since then, Maine DACF, Maine DEP, and Maine CDC have formed a closely coordinated effort to investigate and address these PFAS in Maine. Maine DEP has been tasked by the legislature to test groundwater and soil at all locations with known sludge or septic applications, which is over 700 sites. So they definitely have a lot of work to do. They have conducted testing in late 2021. They started with their tier 1, or the sites that are expected to have the highest impacts. That testing led to 32 farms being identified, where DACF then steps in, conducts additional testing, and we worked with the farms to interpret the results and identify mitigation strategies. Maine CDC has developed an understanding of samples that are of concern and what that means. We've implemented action levels for both milk and beef tissue, and there are more action levels that have been proposed and are under review. It may be a surprising amount of farms because we have an additional 8 or so that have proactively reached out to us. So we have a total of about 40 farms that we're working with right now. But it's really important for everyone to understand that the levels of impact vary and each such situation is really unique. We follow a data-driven process to work with those farms and implement strategies. The last thing I'll say is that the legislature also created a new 60 million PFAS fund for assistance to PFAS impacted farms. That board will have oversight by an advisory board, and their first public meeting is scheduled for November 14th for those who may be interested. That fund will focus on financial assistance, including possibly land acquisition of contaminated sites, health monitoring, and research.
Thank you, Megan. Jean, our next question goes to you. Maine currently has a temporary standard that allows some PFAS in drinking water at 20 parts per trillion. However, this summer, the federal government released updated advisories recommending lifetime exposure through drinking water to be at non-detect or near zero levels. It has proposed designating certain PFAS chemicals as hazardous substances, and it plans to release its own guideline for the level of acceptable PFAS in drinking water relatively soon. Many people are wondering about what these changing levels mean for them. If their private well or community water system has PFAS and it's below the state standard, but above the federal advisory level, as has been the case in a number of places, what do you think is the ideal course of action?
Yeah, the softball question, right? I don't think there's an ideal course of action. Really, what the real difficulty in figuring out what to shoot for is that there are so many different compounds that are involved here, and they all behave a little bit differently in the environment, and the chemistry of the water can also impact how likely they are to be taken up and how treatable actually the water is going to be. So all of this makes it very confusing and difficult to come up with a defensible value to try to shoot for. That said, nobody needs to have PFAS in their bodies. Like everyone should be trying to minimize their exposures to PFAS. And one thing that you can do really is talk to your water board or your town council and say, you know, what are you doing about this? Like, what steps are being taken right now to reduce the PFAS concentration? And chances are you're not going to get much joy with that approach if the numbers are below the regulatory levels in the state, because that's what is governing what people here need to do. And the state is, I think, quite wisely really concentrating most on the areas that have the greatest contamination. But you should still push. Like, citizens should use their voice to try to make things better for their communities. But there are things you can do individually to try to reduce your exposure. So one thing you can do is install either a house filter or a point of use filter. So there's two ways that you can filter water coming into your house. One is where you treat all of the water that comes in, and that's a more expensive option and not really necessary for PFAS contamination. A more economical approach, and one that would achieve the goal of reducing your major exposure route, which is through drinking water and cooking with water that has PFAS, would be to put an under the sink or point of use treatment system. There's really two kinds that are effective and that work, well, three kinds that can work in your home. One of them is called reverse osmosis. It's a mechanism that just uses a filtration medium and some pressure and pushes water through that removes the contaminants in the water. And that'll take care of a lot of contaminants that could potentially be in your water, including, you know, corrosion products and things that come off your plumbing. So that's a good option for people. Granulated activated carbon is another method. It's like the carbon filters. It's similar to what would be in a Brita jug that you could use to treat the water that you're drinking as well. And another method that you can use is called ion exchange, that you can also put under the sink, and it'll treat everything that comes to the kitchen sink and make that safe to use. I guess the thing to look out for if you're shopping for a treatment system is to make sure that it's certified for treating PFAS chemicals. So the National Sanitation Foundation, NSF, certifies treatment systems. So look for that certification when you buy. So drinking water is probably the major pathway of support, and certainly for people whose drinking water is impacted. And then, you know, other forms of exposure that I would be trying to minimize would just be, you know, eating organically grown food. So you avoid the stuff that's the PFAS that have been found to be in pesticide formulations. Not using highly packaged foods because there's PFAS associated with food contact papers and some packaging. And I guess, you know, nobody wants to give up their breathable rainwear. So just be careful when you're doing the laundry. Don't breathe in the dust. And yeah, just try to minimize your exposure that way. Everything comes at a cost. So ultimately, you're looking at your willingness to put up with some risk and the cost in time and money that it'll cost. And, you know, if I had kids in the house, I would think pretty seriously about treating the water, because exposures to children during development is really important, because those effects can last for longer. So long answer to a short question.
Thank you, Jean. And can you tell us a little bit more? What are the reasons? Why is it difficult for community water systems and wastewater treatment plants to get PFAS out of their systems?
Yeah. So one reason is that these things have a biological effect at such a low concentration. I mean, it basically has to be zero. And it is extremely difficult to take a contaminated medium, whether it's water or air or soil, and reduce entirely the concentration of something that you're trying to separate from it. So everything involves a partition, and there's always some left over in the material. So part of the issue is that we're talking about these concentrations that are 1,000,000 times lower than most of the contaminants that we're trying to take out of drinking water and certainly wastewater. So for drinking water, it's the low concentration, the fact that PFAS are relatively water soluble, especially the smaller ones, which have replaced a lot of the larger, longer chain legacy compounds. They're much more likely to break through the treatment system and find their way into your water. So it's really hard. And the industry is trying really to develop better methods that are more specific and are going to take out more of these materials, but it's a tall order. When it comes to wastewater, the treatment is so much more difficult, in part because the wastewater treatment plant has no control over the materials that come in. And really, the wastewater in the olden days was a mixture of kind of like food-related materials and human waste materials. But now there's tons of things that go down our drains that are at much lower levels and that are much more difficult to deal with. So there's skin and hair products, cleaners, arts and crafts supplies or renovation supplies, textile treatments, pharmaceuticals, pipe corrosion materials, all of these things. It's this big jumble of chemicals that are present at low concentrations that get into the wastewater treatment plant. And what happens at the wastewater treatment plant is you have first a settling tank where anything that's solid and suspended in the water gets removed. And then there's a biological process that converts dissolved organic matter into biomass. That's the sludge we hear about. And that gets settled out in another settling tank. Then the cleaned water gets disinfected and it goes back out into the environment. So these PFAS have no natural degradation pathways. They're not going to get converted into biomass and gases that will leave the system. So they stay, and they can either go out with the water if they're short chain materials, or they'll just get stuck on the biosolids and stick to that the same way it would stick to the activated carbon in your drinking water treatment system, and accumulate there to be then applied to soils. So it's a monumental task to get them out, and there aren't really good treatments yet. I think we're gonna have to come up with some post-treatment methods and ways to try to deal with the solids, alternative ways to deal with the solids to try to reduce the overall amount and still extract what we need to get out of those materials. But yeah, no good perfect answers on that one yet either.
Thanks for sharing that with us, Jean. Noah, over to you. As we just talked about, PFAS can accumulate in our bodies, and the research shows that this can lead to adverse health effects. What exactly do PFAS chemicals do to our bodies? What risks do PFAS pose to our health? And how confident are researchers about those risks? Can we say that the health risks are proven or not?
That's a really good question. So there's more than one answer to that. Fortunately, the National Academy of Sciences put together an expert work group to tackle questions like this. They examined all of the research available and heard from lots of other experts in this field as well, and arrived at some conclusions. So there were four instances of health consequences of PFAS that they found had sufficient evidence of an association that it should raise concern. So it's really important to understand the difference between association and causality. And so it isn't yet proven that PFAS causes these things, but there's a strong enough association between PFAS exposure and these problems that it merits evaluation and monitoring and raises our level of concern. So those four things are a decreased antibody response in adults and children. That is, especially in regards to vaccinations, it may reduce a person's response to vaccinations, so they get a lower level of immunity from the vaccination than they otherwise would. Abnormal elevation in cholesterol in both adults and children. That's not a disease. Obviously, that's a risk factor for disease, specifically heart and vascular disease. But it's reasonable to make the assumption that elevation in cholesterol that can result from this, that may result from this exposure, may increase the risk of those problems. It causes slight changes in infant and fetal growth. So it retards infant and fetal growth, not in dramatic fashion, but to some extent. And that's a concern. And I don't think we know if that's dose related. And so it makes you wonder about children, especially, and pregnant women who have higher levels of exposure, if there may be more dramatic effects. And finally, the one cancer that there is a sufficient evidence of association is in adults, and it's a risk of kidney cancer. So those are the four things: immune responses, cholesterol levels, decreased growth in children, and kidney cancer in adults. There's another list of potential problems that have some evidence of an association, but not strong evidence, so limited, or the suggestion of an association. And those include an increased risk of breast cancer in adults, abnormal liver enzymes in adults and children. So something in the liver that makes the blood tests that we monitor to assess liver function to be abnormal. Increased risk of pregnancy complications like high blood pressure and what's called preeclampsia, which is a combination of high blood pressure and other complications of pregnancy that can occur. An increased risk of testicular cancer in males, increased risk of thyroid disease and abnormal thyroid function in adults, and an increased risk of an inflammatory bowel disease called ulcerative colitis in adults. So that list of things are problems for which there's some limited evidence of association with PFAS exposure, but not strong enough to put it in that first category of the other four things.
Noah, thanks for sharing about those effects on health. Meagan, I'd like to ask you about the effects on farmers in particular. To date, what have been the biggest harms to farms and farmers from PFAS contamination? How are those harms affecting the local food economy? And what support do farmers need?
And so unfortunately, the effects are huge. Not to be dismissed are the concerns the farmers have of the health impacts on their family, that all the things that Noah just spoke about, that's definitely a big concern for them. Then there's also just the physical and the mental well-being. So we know that farming is a challenging livelihood, and then you add the unknown and uncertainty of PFAS contamination, and that is really scary and hard to contend with. It also, unfortunately, does threaten their economic livelihood and the farmer's way of life. So the impacts can't really be overstated. There are things that we at Maine DACF can do to support the farms. So we try to do comprehensive testing to determine all of the potential exposure pathways on the farm. That could be within the farm or coming from off farm, for example, if they're buying contaminated hay, and helping them address those pathways to try to get to a solution for them. Unfortunately, there are limited accredited labs nationwide, and they're all in high demand. So we are seeing turnaround times in the 6 to 8 week time frame, again, adding to that uncertainty and the mental anguish while you're waiting for those test results to come back. And during that time, the farm may need to take their products off the shelf out of an abundance of caution, but that immediately stops the income flow. And then it also risks their market share, which usually they've spent years cultivating. So we can provide financial assistance. So income replacement is one way that we do that. We also have funds available to help provide infrastructure if a farm needs to do some pivoting, making some changes. And I do need to thank our friends at MFT and MFT for providing swift financial support. The state of Maine SHIP is not always good at that skill, so we really appreciate that. We know that this is not just a Maine problem, it's a national problem. We're just happen to be out here addressing it first. We are trying to build a really robust understanding of the safety network in Maine, for the food network, with respect to PFAS in the next few years. We have about 7,500 farms in Maine. We expect most of them to be having safe products, but it's imperative that we identify and support those with contamination in the near term. And as consumers, all of us on this call, we can support our Maine farms by taking the time to understand that PFAS impacts isn't a universal story. So thank you everyone for joining tonight, and recognizing that we can have safe products even when there is identified and known contamination, and spending our local dollars on our local food economy.
Thanks, Meagan. As a follow-up to that question, can you talk a bit about what mitigation options are available if soil or farm products are found to be contaminated? What are the options at this time?
Yeah, so right now, mostly it's strategic management choices, which is a big part of why we do so much testing on a farm. So we conduct and pay for samples of soil, water, milk, feed, produce that they're producing, whatever may be applicable to that farm. And in a lot of cases, we'll also establish an ongoing monitoring program, for example, in the case of a dairy farm. Once we understand kind of our starting point, so the level of contamination and the specific compounds, Jean spoke a little about different compounds behaving differently, and that holds true on the farms too. So for example, PFOA doesn't seem to transfer to beef tissue, and some products like asparagus, garlic, potato, and some grains seem to have low uptake of all of the compounds. So it's a really nuanced story and specific to each farm. We will work with the farm and Maine CDC to understand the test results and provide some of that interpretation. And then we work with a producer to stop ongoing contamination where we do see that. That could mean avoiding certain fields. It could mean purchasing clean feed for the animals, especially if you're reducing your grazing capacity by avoiding your fields, you may need to purchase more feed. We also do install water filters for farms that's applicable for, and that can be really effective. Different animals have different half-lives, which is the time that it takes for the contamination level to drop by half. For different compounds, we are working with Maine CDC to understand that, provide realistic timelines to producers. And we're still learning a lot collectively. So we are grateful and glad that we've had some successful cases, and despite producers facing some really challenging decisions. And we also are hopeful that some of the research out there about potential soil remediation strategies might turn up some real solutions that get at the root problems. Right now, we're really acting on mitigation strategies and having some success, but hopefully some of those remediations can come through for us.
Thank you for shedding light on that, Meagan. Noah, we'd like to hear more about what can be done if PFAS are detected in our bodies. The National Academies of Sciences, Engineering, and Medicine recently came out with recommendations for who should get their blood tested to see if they have PFAS. These are people who have been exposed through their drinking water or through jobs that increase their exposure, such as firefighters, those who work at airports or military bases, at wastewater treatment plants or landfills, or farmers living and working on or near farmland where sludge has been spread. If people fall into these categories of exposure, how can they actually go about getting tested, and what should they know before they get tested? For instance, how available are tests? Are any of them covered by insurance, and are doctors prepared to even talk about PFAS?
I think your last question is the most important question. So one of the key recommendations of the National Academy of Sciences was that public health entities educate physicians and nurse practitioners and physician assistants about PFAS, about who's at risk and what they can and should do for them. There isn't any mitigation strategy clinically, right? If you have an elevated level of PFAS, we don't have currently any way to intervene and lower your level of PFAS. But this report also does recommend that we do offer testing to people who have the kind of exposures that you just went through. Insurance coverage is likely variable around all of this. These tests are expensive. I checked with a private lab, and their out-of-pocket cost for one of these tests is over $600. So in discussing testing with, so first of all, those of us who provide care need to have our awareness and knowledge about this problem elevated, and we'll need help with that. In discussing testing with people, they have to understand the potential risks and the potential benefits of testing. That's especially true in any condition or circumstance where we don't have a treatment to say, okay, if we find that, we can cure it or we can reduce your chances of complications. That's not the case with PFAS. So people have to understand the nuances of this. So there's the usual risks like, bruising from a blood draw, which are obviously trivial and people don't really take into consideration. But there is concern about, the psychological impact of knowing that you have an elevated level of PFAS. There's concern about the potential social impacts. If your friends and neighbors and family find out that you have elevated levels of PFAS, what that might mean for them. And of course, it's not contagious or spreadable in that way, but people worry about these things. And then unnecessary additional testing that may or may not be indicated, but is driven by concern about an elevated PFAS level. Obviously, the benefits are that we know these things that are associated with PFAS exposure, and so monitoring for the development of those things makes sense. It'd be, if you have an elevated level and know it, it helps guide your treatment based on your understanding of your risks, your own values, and the recommendations of the people who provide medical care to you. So preventive care, monitoring, and obviously keeping track of new developments, new treatments, new interventions, or new recommendations around all of this. So I think there's going to be increased demand for PFAS testing, obviously individual PFAS testing as time goes by. Typically, it's an expensive test, and insurances are not likely to jump on board with this, especially because there aren't really effective interventions for PFAS exposure when they occur. And so cost is going to be an issue for lots of people, and availability of testing is going to be a concern in a lot of areas. In a rural state like Maine, it's not so easy, to arrange unusual testing. It requires, mailing or using a courier to transport specimens, for instance, to get to a lab that can do it. And the turnaround time, at least for this private lab, was about 2 weeks for a test result. And I think that's also important for people to know, that you don't get an immediate answer.
Thanks for that, Noah. Before we move on to questions from our audience, we'd love to hear from each of you. Maine has done a lot around PFAS. We encourage people to read about all the efforts underway on the Maine DEP website. There's ongoing testing happening across the state, as Meagan mentioned. In 2021, the state of Maine passed a bill requiring manufacturers to disclose products intentionally made with PFAS and empowering the DEP to ban the sale of certain PFAS-containing products, effective in 2030. In 2022, the state banned the spreading of sludge and sludge-derived compost. There's research underway into effective removal techniques, and some landfills are looking into treatment options. The Ensign-Madison Sanitary District in Somerset County is trying to develop a regional treatment center for PFAS and sludge waste. What do you think are the most important steps being taken right now to tackle this issue in Maine within each of your specialty areas? And what are you most hopeful for? Can we start with Jean?
Sure. I'm really excited about the fact that Maine was going to actually ban the import of these materials. I mean, really, that is the first thing we have to do, because they're not going anywhere. We need to stop making them and using them whenever there's an alternative available. And I'm also super excited about some new, there's a new method of low temperature destruction of PFAS that it's nowhere near ready for prime time yet for actual use in, say, drinking water, because you'd have to add too much other chemicals to the water and then you'd have to get that stuff out again. But it's really exciting to know that there are actual methods of breaking down these compounds that are so stable under traditional treatment conditions. So I'm hopeful that there's going to be effective treatment within 10 years. But like before all of that stuff, we need to stop these coming in and deal with the contamination that we have now.
Great, thanks. Noah, would you like to go next?
Yes, sure. I'm very encouraged that the legislature, that public health entities in Maine, the Maine Public Health Association, see the importance of this issue and are working to get out in front of it. I think from a primary care perspective, the Nesin report, it offers very practical support for people doing primary care, for instance, which is my area of specialty, and not surprisingly, because the chair of that group is a family doctor, and my hope is that we are able to provide for people providing care and for the people we serve, our patients and our communities, really practical information about what they can do to mitigate risk for themselves, and what they should be advocating for their community and for our state. So we get questions, should I throw out my Teflon pans? Do I need to stop wearing Gore-Tex? Should I stop eating fast food? The answer to that is always yes, regardless of the packaging of the fast food. But so just really practical support for and information for both those of us who provide care and people who seek that care, so that we really can have consistent and helpful messaging.
Thanks a lot. Meagan?
Yeah, so for me, from the agricultural perspective, we are building a picture of Maine agricultural lands right now, and we've been learning so much through our testing, our analysis, and discussions with farms. So we have been identifying and improving the support mechanisms that are out there. And we have seen farms make pivots, make changes, and successfully produce safe products. So that really gives us a lot of hope and encouragement that we can keep having more success stories. So like I mentioned, animals can be depurated, water can be filtered, mitigation strategies can be utilized. And as we keep gaining further understanding, things like uptake in plants and livestock, the more we test, the more we learn, our recommendations will continue to improve, and hopefully that will benefit additional farms down the line. Another thing that I wanted to highlight was the collaboration that we see between Maine state agencies. Like I said, DEP, DACF, CDC, we all are talking weekly, if not daily, and outside collaborators like MFT and MFT and UMaine. There's a lot of people who are working really hard to address this. And that makes me confident that given public support, financial support, research, and some time, we can solve this.
Thank you so much, Jean, Meagan, and Noah, for such insightful answers. I think now we'd like to open up questions from our audience. We have some questions that were submitted through the registration form, and I know we've got some live questions that have been coming in through the Q&A here on Zoom. So to begin with, when we started our conversation, Meagan mentioned a farm in 2016 that discovered PFAS contamination, which led to a much greater awareness of the issue. So we have that farmer, Fred Stone of Stone Ridge Farm in Arundel, on the line. Fred would like to share a few words about his experience as a farmer and also ask a question. Fred? Fred, I think you're on mute. If you could unmute, please. Thank you.
There we go. Oh, we're there. We're there now. Great. I love it when technology works. My name is Fred Stone of Stone Ridge Farm Inc. We are a 3-generation dairy farm that was started in 1914 by my grandfather. Way back when, we're a commercial dairy operation. And up until a few years ago, we shipped our milk to Oakhurst for over 20 some odd years. And I am probably the reason that we are all here tonight. We have been dubbed as ground zero because our nightmare started on November 3rd of 16, when the water in our aquifer was at 146. We immediately notified the state and notified Oakhurst area that there was a problem. That is, I guess, when our bloodbath just began. And it has been a consuming nightmare from the word go, both by the treatment that we received from the state and from USDA. It's been a constant battle with everyone. And I apologize. I do not mean to step on anybody's toes, because we have to work with everybody, and we have to work with these people. So having said that, if you've read, I think it was in today's Bloomberg News, Maeve Sheehy wrote an article quoting both myself and Art Schaap from Clovis, New Mexico, on the culminations of our USDA are being paid for our dead cows. That's an ongoing challenge, but I learned today, or I learned last week that the herd of cows, Richard Holsteins and Brown Swiss, that I spent 44 years developing, um, that would have been worth somewhere around 250 to 300,000. We received a check for $63,000. I would say that that was a bit of a slap in the face. Not to mention the farmland and everything else that goes with it. And long story short point, but I will probably have to be making a few decisions in the next few weeks on whether we get to file a personal Chapter 12. The farm is an S corp. Our lender, of course, is very good and wants to do that. The house is in our personal names, and that lender believes that the places are worth a bazillion dollars when they're contaminated. That is another issue going forward. This is a complete bloodbath for anybody that gets involved in this mess, and I can see why it's very hard or very difficult for people to come forward. My moral compass, as I like to say, is at $1.5 million and counting. If I had it to do all over again, I would do it in a heartbeat. I'm sorry, my wife told me to behave myself and we were supposed to move on. So moving on, the reason that Maine is ahead of the curve on all this has to do with a few people that have pushed this issue forward. I'll pat myself on the back and say it was myself, but it was also other people that were involved in this because there is no I in team. I was at the Wilmington conference in June, and it was amazing. And I was actually one of the speakers, and it was amazing the gratitude that we had from people from all over the country telling us that Maine is doing the right thing and let's move forward. Thank you much for your time. I appreciate you allowing me the minutes to make a few comments. And I am not a speaker. I am a stupid dairy farmer from Rundle, Maine that seems to be putting a Rundle on the map for some odd reason.
Fred, did you also have a question you'd like to ask our panelists?
Where do we go from here?
All right, thank you.
I'm sorry. No, it was more of a specific one than that. And I can say, how do we get our lives back? But I mean, how are we going to work this into compensating the dairy operations as opposed to the veggie operations, as opposed to the beef operations? This thing is a thing that has tentacles that go in a bazillion different directions, not to mention our health issues. Your blood level should be 2 or 4. Mine's 111. My wife's is 91. We have all the health issues that are correlated with this. My son and my daughters are in the lower 50s. Again, where do we go from here? What do we do? How are we supposed to correlate this? What am I supposed to tell my lenders? You've completely decimated my dairy operation. What did I do wrong here? I was the one that brought up that permit from DEP that was dated 1986 is one that everybody's pushed around. That was why that bill in 21 got passed, if I remember correctly, in front of the Natural Resources and Conservation Committee. I testified for that. And on that DEP permit, it was to Kennebunk Sewer District, stating on DEP's masthead that this material will not contaminate any waters of the state of Maine. This material will not present a health hazard to anyone in the state of Maine. And on the reverse side of it, it was signed by the commissioner of DEP. Now, me being the stupid dairy farmer that I am, as we've been told by many people, believed them. So is this a thing from Animal House where you said, well, you screwed up, Freddie. You should have kept your mouth shut. I mean, you should have, should not have trusted us. And then I've had people in our dairy community, both organic and conventional, tell me in no uncertain terms that, well, you screwed up. Our lives have been a hell of a lot better off if you just kept your mouth shut, because it's not like you had to drink the milk, drink the water, or eat the meat. Hence why I can take a show string and take them anywhere in the United States, because those animals are contaminated. They're not contagious. So my veterinarian, who's also my friend, can write my health charts, but I'll be damned if I can show them in Maine. Why is that? I'm sorry, I don't mean to step on toes. But we are beyond pissed. And So you either laugh, cry, or move on. And I ran out of tears a long time ago. I'm sorry. I promised I would behave, so I kept out. I'll keep my quiet. But what am I supposed to do?
No, thank you so much, Fred, for sharing your concerns with us. If any of the panelists would like to address this, please feel free to answer.
I can try to address some of those. There's a lot of big questions in there. But one thing that I would say is, Fred, I don't think this is not a Maine problem. This is not specific to Maine. And I am so sorry for the experience that you have had. And by the way, it's nice to meet you as a new member of Maine DECF.
You probably won't say that again.
But we do recognize that, more and more states are becoming more aware of this. Maine has been at the forefront, but we will not be the last one. So I guess as far as that piece of it, I definitely want to say that much, that we're learning a lot. And I think that will hopefully stand farms in good stead, that we are learning, we have infrastructure in place. We're ready to go if and when the federal level takes some actions. So that hopefully we can view that as a positive for Maine. In terms of some of your other questions, I think those are some bigger questions than maybe we can really address adequately in this forum. But I would also like to invite you to always reach out to Maine DACF and have some of those conversations and hear your thoughts on what maybe can be improved. You unfortunately did have the experience of being at the forefront here, and a lot has changed, I think, between 2016 and 2022, and how we can work with farms. But your input is valued.
Yes, thank you, Meagan, for speaking to that. And thank you, Fred, for sharing your concerns and your story with us. I'd like to move to our next question, which a lot of people have been asking about testing. So Daniel asks, what is the accessibility of soil and water testing for PFAS at a consumer non-business level? And Patricia and Sheila are asking related questions as well about how homeowners should order a test kit, evaluate the accuracy of the types of tests that are out there, and whether testing facilities are authorized and able to process the tests. Meagan or Jean, can either of you shed light on these questions?
So I think it is difficult to get testing at an accredited lab. The majority, if not all, the capacity is being taken up by DEP's requirement to test all of the places where a sludge has been applied, and then do additional testing to find where any contamination has spread from the areas where those materials were applied to land. So it's difficult to obtain a test if you think you're in an affected area. There's an application process, I think, to have your water tested through the Maine Environmental Testing Lab. I think I saw in the Q&A there was a question about a commercial outfit that is using a novel technology to test PFAS, and it's much less expensive than the using a certified lab. But the downside of using a novel technology is it's not very well tested. So the reliability of the results would maybe be a little bit questionable. I think if you're using it as a screening, I would maybe think about it, because it's on the order of $100 instead of $600. You could, if you were really concerned and you didn't sort of meet the bar of DEP's testing, where they would buy your test for you, you could think about using that with, I forget what it's called, Cyclopure, or I'm looking for the Q&A question. In any case, that is a it would be an option. I can't speak to the accuracy of the results that you would get from it, but it, you know, it sounds like feasible. It sounds like the detection method is quite similar to the certified testing method. So it's likely going to turn out to be useful, and maybe it'll be a game changer in making it easier for people to test their water. Sorry, it's not the best answer, but I would try it.
Thank you, Jean. We're going to quickly go through a few of these questions. We're running a little short on time, so I want to quickly address the questions that we can. So Butler asks, what happens now with the sludge from wastewater treatment facilities? Have to assume that none is used on farms. And additionally, some schools, for some reason, have had high PFAS results. Should one assume adjoining properties be susceptible, or the cause? If somebody would like to answer that question, please feel free to speak up.
Sure. So I think that almost all of the sludge now is going to landfill, most of that at Juniper Ridge, just north of here. So that's not an ideal solution for sludge. It's not a particularly good thing to go into landfill. It's too wet, and it has too much organic matter, so it makes a lot of methane. But that's the option that we have right now. As far as schools having PFAS contamination, I mean, if a school is down gradient of a place where PFAS was applied, or someplace where in the past there had been firefighting training, that could result in it. I think also there is some materials that have been turned into like playing fields that may have some form of contamination. It's really difficult to say unless you know more about an individual site. So I can't really speak to what's happening at those sites.
Great. Thank you, Jean, for answering that. And now Nick asks, given that economically underclassed farmers will inevitably see a great impact from PFAS at this stage, what is being done to ensure that research and solutions are directed specifically towards historically marginalized and disproportionately affected communities? I think this is a very important question. Meagan, could you share your thoughts on this?
Yeah, I can at least try to. So it's a great question, and one that actually came up today. I'm participating on a diversity, equity, and inclusion program that the Bureau of Food and Rural Resources is doing as a full bureau. So it's definitely a question that is out on our minds. I don't have a lot of answers about the solutions about that right now, but I would say that it is something that has come up. And as we've been learning a lot and adding farms, honestly, it has been a bit of a scramble to work with each of these farms. Like I said, each conversation is really nuanced. So we've been pretty focused on some of the day-to-day operations and needs, but some of those big picture questions are incredibly important, and I appreciate the question.
Thank you, Meagan. And now real quick, with the interest of time, Mary asks, should everyone be checking their water and deer meat for PFAS? In our Q&A box, Paul also adds, what does current science say about bioaccumulation of PFAS in the food chain, especially concentrations in fish? And how should that inform decisions about what we eat? So panelists, could you kindly share more about the food chain and what we know about what we should eat? Then I guess if Noah or Jean want to start first.
Sure. Well, if you consume fish or animals who are in potentially contaminated areas, that's one of the reasons to consider personal testing of blood levels of PFAS. And the contaminated areas are the same, obviously, as for humans. That is, near military bases or airfields or industries that use these chemicals, or wastewater treatment plants, or in a community where it's already been determined that there are high levels, for instance, in the water supply. If that water supply, includes is where the fish are that you're consuming, for instance. So those are the personal considerations.
Thank you, Noah. Jean, would you like to briefly add to that?
Yeah, I think there needs to be a reason to believe that the animal that you're consuming has been in a contaminated area. And similarly, I think that people shouldn't panic about their drinking water unless they know that there's contamination near where their aquifer is. So by and large, Maine is not contaminated that broadly. There's plenty of contaminated sites and some places with very high levels, and people should be, and that's why the DEP is really focusing their efforts on testing in those areas and reaching out to people who may have contamination. But as they're not going to catch every instance, probably. They're looking at the high likelihood areas. So if you're really concerned about it, you could test your drinking water. And similarly with food, really there's maps available through the EGAD website where you can actually look at places where there have been hotspots and then maybe think about not fishing in those areas. I think it's probably the most, prudent approach.
Thank you, Jean. I'd like to first thank everybody who sent in the questions to the Q&A and also to the panelists for answering them. So we have one final question for all of our panelists tonight. As one of the few states currently testing for PFAS chemicals in water and soil, Maine is on the front lines of understanding where the chemicals have ended up and what support our communities need when high concentrations are detected. What can other states and the federal government learn from Maine's response? And what do you think should be prioritized at the federal level when it comes to addressing the PFAS crisis? And I'd like all of the panelists to answer this question. Noah, would you like to begin with that?
Yeah, I mean, I think the broad lesson is that this, as with, for instance, the pandemic, is a place where public health and individual health concerns overlap very significantly, and that's a complicated intersection that states and public health entities and individuals have to navigate. And so I think that requires a lot of thought and consideration. I think a priority, I'm the grandson of a farmer, so I'm not a farmer myself, but I think the first priority is to support the farmers and the people who work on farms who have been so dramatically impacted by this. They provide our food and usually not at great profit for small farm owners. And we should advocate that we and our government take care of them through all of this.
Thank you, Noah. Meagan, would you like to share your response to that?
Sure. So yeah, we have been out front as a state and we have been learning a lot and we have had to adapt and learn. So we can suggest some pathways for others. The other states have been reaching out to us and we're always happy to talk to them. This week, we actually had someone reach out from Australia, which was pretty cool. So now I can say other countries as well. And we're happy to share our experiences with them, and particularly the real world and the field-based research that DACF and CDC has been conducting and adding to our knowledge base really quickly. And I would say that federally, we're really hopeful that there'll be a coordinated PFAS response, including federal action thresholds. Agriculture commerce is usually across state lines, so that would be a real benefit. And along with that, the financial assistance, the expanding existing federal programs, primarily at USDA, to include PFAS response and support. And we need support for targeted research, especially some of those remediation options that are hopefully coming.
Thank you, Megan. Jean?
Yeah, I echo that, and I think it's going to be really important for the federal government to step in and fund remediation at places where the contamination is severe, so that so we don't end up with sacrifice zones. And like farms should not be sacrifice zones. We all need to eat. We all and the hard sell on sledge application was pretty widespread. I think everybody should be pitching in to try to help solve this problem.
Thank you all very much. We wish that we could continue this conversation all evening, but we're already 7 minutes over time. So I think it's time to wrap things up tonight. Mehr and Tricia, thank you so much for moderating this thoughtful discussion. Jean, Noah, and Megan, thank you all very much for joining us and sharing your insights with us. And Fred, also thank you for sharing your experience with us. We appreciate that you are out in front and we are grateful to you. And to everyone, thank you for your questions and your participation tonight. We look forward to continuing this conversation in a few weeks. Mark your calendars for Tuesday, November 15th at 5:30 for our part 2 event, where we'll be focusing on what can be done and hopefully also getting to some of those questions that came in that were more focused on solutions and innovation. We're keeping notes and bringing those forward to the next conversation. So we'll learn in that session about current and future research and innovation to lead us closer to solutions to the PFAS problem. We hope you'll join us. In the meantime, please watch your inbox for an event recap email with links to resources mentioned tonight and also the recording of this conversation, so you'll have that for future reference. Thank you again. Have a great night.